My name is Dr. Abdourahmane Diallo. I'm the WHO representative in Kenya. WHO is the strategic and technical advisor to member states, in this particular case, Kenya, through the Ministry of Health. So WHO directly supports the Ministry of Health in the area of immunization in terms of articulating and formulating the right policies for immunization, supporting the Ministry of Health in unpacking and implementing those policies. Now, when it comes to immunizations, such as the campaign that we're talking about, so WHO has been working with the Ministry of Health to unpack universal health coverage. Part of that is interventions at the community level. So, as you've seen, this is a campaign. When you say campaign, it's actually getting out of the routine program and reaching out to communities, to people who actually need these services. In this case, the strategy involves using fixed infrastructure, using temporary infrastructures, and actually also deliberately and physically going into the communities, into the underserved area. So this is part of delivering uh, services really at the community level. One would package them in terms of primary healthcare services. Not to mention that the critical role or that the community health promoters play in this exercise. So they are trained, they reach out to communities, they advocate to communities, they educate communities, they're part of this exercise. So all this, that capacity building exercise, intervention at the community level can be wrapped as a comprehensive package of primary care services. It's true that the current environment of public health is stressed in terms of finances. So the approaches that are being used do not apply only to immunization. They apply to public health in general. First, we have to look into implementing efficiency measures. What does that mean? We have to prioritize. So different interventions that we've been doing, can we do them all? Can we do them the way we have been doing them to date? Those are questions that we ask to ourselves. But what in general has been recommended is one, to look at our strategic plan, look at our work plans, prioritize based on what is absolutely necessary and what we can afford. That's one. Two, it is bringing efficiencies in the way we do business. We have to think integration. And this campaign is a very good example of integration. As you see, it's actually measles rubella that is being combined with the TCV. So it's two vaccines that are being delivered into one approach. So there is efficiency there when it comes to planning, when it comes to capacity building, when it comes to logistics, when it comes also to mobilizing the receiving population, the beneficiary populations. So you move them only once. And when you also work with county governments to find the facilities where these campaigns are taking place, so you do that once. So it is a way of integrating, recognizing that there are limited resources, so leveraging those resources, optimizing the interventions to do this. But you can say that that approach can be applied pretty much to everything in public health, not only in immunization. And we heard from the Director General today an excellent news. Kenya has mobilized the necessary resources to fulfill its co-financing obligation with Gavi, but also to fulfill its own responsibility when it comes to procuring vaccine. This is a result of the Kenyan government prioritizing health, but also prioritizing immunization as a way to actually prevent disease. Of course, the partners have been available, have been closely working with the Ministry of Health, have been closely supporting, advocating with Treasury and different branches of government that intervene in this area. So this campaign not only provides coverage for measles and rubella, but also introduces TCV, like one way of strengthening routine immunization. But every time you actually plan and execute a campaign, you actually build capacity. In this particular case, from the micro planning, the actual planning of this vaccine, the capacity building that is done, the involvement of the different actors and players, such as the advisory committees, the role of community health promoters that you do, it's not a one-time exercise. So it is something that will benefit the routine immunization program in the long run.